So I'm just going to give first like a high level overview just about newborn screening for those who may not be familiar with the system. So in the US, newborn screening is a state-based public health system, and it screens babies for genetic diseases at birth. This usually happens around 24 to 48 hours after the baby's born. If you've had a baby, you probably remember them coming back to you with a little Band-Aid on their heel. So a few drops of blood are taken from the baby's heel and they're screened for a number of diseases. And the diseases that are included in newborn screening are rare genetic diseases that can only be treated prior to the onset of symptoms. So for example, like Krabbe disease or adrenoleukodystrophy. Newborn screening detects these diseases early enough for the child to fully benefit from disease-altering treatment for the disease. And it's interesting because I always say it's like the best kept secret because newborn screening's been around for over 50 years, but most parents aren't even aware that the system exists until there's a problem, unfortunately. So Hunter's Hope's efforts for expanded newborn screening for Krabbe and other leukodystrophies has several components. And of course, the ultimate goal is nationwide and eventually worldwide screening for Krabbe disease and for other leukodystrophies. Our advocacy efforts involve both state and federal efforts through our state advocacy initiatives. And I've had the privilege of working with many on this call. We partner with families across the country to advocate for expanded newborn screening for Krabbe and other leukodystrophies. And what we do is we try to help launch a grassroots efforts in those states. And so this has led to 10 states currently screening for Krabbe disease. And I have to always say, you know, I'm so honored to have worked with so many amazing families who are just super courageous and selfless, you know, because even though it's too late for your child to benefit from newborn screening, you guys are working tirelessly to make sure that no other family suffers the way that yours has. And on a federal level, Hunter's Hope supports several initiatives, including the Newborn Screening Saves Lives Act, as well as several other efforts to ensure, for example, that our country's newborn screening system has the funding it needs to give all children the best chance at a healthy life. Since the beginning of Hunter's Hope, we've been super blessed to have just an amazing team of medical and scientific partners that have helped us in so many of our initiatives, but I think this is especially true with newborn screening. And so in 2015, we established the Krabbe Newborn Screening Task Force with the purpose of systematically improving Krabbe newborn screening and to prepare for Krabbe's nomination to the Recommended Uniform Screening Panel, or RUSP. That's RUSP, and I'll talk more about that in a minute. Through the task force, several work groups and writing groups have been formed, not only to help make scientific advancements to improve Krabbe newborn screening, but also to make sure that new data was created and published in a timely manner. From the task force, we also formed the Krabbe disease RUSP work group, which I will talk about in just a minute. I did want to talk briefly about the Krabbe Newborn Screening Advisory Council, which is a relatively new effort that kind of grew organically out of the task force. So we launched this in 2020, and the ultimate purpose of the council is to make sure that patients identified through Krabbe newborn screening have the best possible outcomes, and to help clinicians. You know, not everybody is going to be an expert at Krabbe disease. The doctors that treat patients who have a positive screen for Krabbe also treat patients who have a positive screen for the 50 other diseases that their state might screen for. So we have designed the council to be a really easy group for doctors to come in and out of as they need to. Many times doctors will come in when they might have a complex patient and they need to talk through the case with other experts. But the group meets every month, and it is co-led by Dr. Joanne Kurtzberg from Duke University, and also Dr. Joe Orsini from the New York Newborn Screening Program. Like I said, the council meets every month. We have over 70 members, and it's open to any medical provider who treats patients identified through Krabbe newborn screening. We have newborn screening professionals from every state screening for Krabbe that attend. And then, like I said, newborn screening and Krabbe disease experts also attend. You can learn more about the council and everything else that I've mentioned so far tonight on our website. Let's see. So I also just wanted to briefly mention that Hunter's Hope partnered with a couple of doctors from the council, as well as some affected families, to create our Krabbe newborn screening family guide. And this is intended for families who have a baby who receives a positive newborn screen for Krabbe disease. As you can imagine, it's an incredibly difficult situation for families because they go from probably not even realizing that their baby is being screened for any diseases at birth to finding out that their child might have or does have Krabbe disease, a disease they've never heard of. And then if they have the infantile form, the family has to act really, really quick. So the guide is actually based on the recently published consensus guidelines for clinicians who treat patients with a positive screen for Krabbe, just to empower families to better understand what the best practices are for their child, depending on what category they fall in, and to know what to expect from their clinicians. So I want to talk, I mentioned before the recommended uniform screening panel. So just to give you a little bit of background, if you're unfamiliar, like I mentioned before, newborn screening started actually with just one disease in 1963. But by the 2000s, there was this huge disparity in the number of diseases each state included in its newborn screening program. And this could range from maybe around 10 diseases to some states over 40. And so, depending on what state you were born in, really depended on your health outcome. So in order to help bridge this gap, in 2006, a federal committee was created called the Advisory Committee on Heritable Disorders for Newborns and Children, or the ACHDNC. This advisory committee is made up of newborn screening, genetic, and pediatric experts who then advise the US Secretary of Health about newborn screening policy and initiatives. So when this committee formed, they created the RUSP that I mentioned earlier, RUSP, which is the Recommended Uniform Screening Panel. And the RUSP was actually initially intended to just be a minimum standard of diseases that could be included in the state's newborn screening panel, so that every state would at least be screening for this number of diseases. And it should be noted that each state does still maintain autonomy as to how many diseases it can include in its newborn screening program. But now many states, unfortunately, are not willing necessarily to start screening for a disease until it is on the RUSP. I'll be honest, it is a slow and extremely difficult process for a disease to be added to the RUSP. In fact, in the 16 years since the advisory committee was formed, they have only recommended 9 diseases to be included on the RUSP, which I believe is, an acquisition rate that's very slow, too slow, given that, children's lives are at stake. A little background on Krabbe newborn screening. In 2006, New York became the first state to include Krabbe disease in its newborn screening program, which is the same year that the Secretary Advisory Committee that I just mentioned was formed. So clearly, newborn screening for Krabbe emerged during a really transitional period for newborn screening in our country. In 2007, Krabbe disease was nominated to be included on the RUSP, and it was not recommended to the committee or by the committee at a vote of 8-7. And during that review, the committee identified 3 evidence gaps that needed to be filled. So after the very difficult blow of Krabbe not making it onto the RUSP by 1 vote, we were faced with needing to fill these evidence gaps so that we could reapply for Krabbe disease to be included on the RUSP. And there were also many other obstacles to overcome. And by the way, this is also around the time that I started working for Hunter's Hope in 2011. So I definitely had my work cut out for me. I'll say that it truly felt like we just had this huge mountain to climb, but like no direction or help in getting to the top. And because Krabbe is so utterly devastating and only treatable if diagnosed prior to the onset of symptoms, we knew that we absolutely could not wait for Krabbe to be on the RUSP to continue our state advocacy efforts. But we also knew that we wouldn't be able to fill these evidence gaps without more states screening for Krabbe, at least not in a reasonable amount of time. So last year, almost a year ago exactly, in July of 2021, with the help of the lovely people on your screen, we resubmitted the nomination package for Krabbe's inclusion on the recommended uniform screening panel. And I just want to thank these people once again for their incredible work during this process. We absolutely could not have done it without them. The Krabbe nomination package was over 1,000 pages, and it is filled with evidence and data proving, in my opinion, that Krabbe should be added to the RUSP, and that the gaps that I just had on the screen that were identified by the committee in 2009, that they are filled. Let's see. So, like I said, we submitted the nomination package almost a year ago. So if you think about the timeline, you know, it took us 10 years to even be able to reapply, to gather all the data, to make the scientific advancements. And then we submit it, and it kind of just sat for a year. But in May of 2022, just a couple of months ago, the committee voted unanimously to move Krabbe to full evidence review. And that review is currently underway. So we passed the first big hurdle unanimously, which was exciting. So the committee will vote no later than February of 2023 regarding whether or not they will recommend to the Secretary of Health to include Krabbe on the RUSP. Ultimately, it's the Secretary of Health's decision, but this person has never, you know, strayed from the committee's recommendation. So, you know, now what? I think anybody who's on the call who has been advocating for Krabbe knows how important this progress with the RUSP is. Many states, unfortunately, do use, you know, the RUSP as an excuse, for lack of a better word, to not add a disease. So for some, it's been a barrier in your state. I believe with my whole heart that Krabbe will be added to the RUSP, but every state will still have to decide if and when they will begin screening for Krabbe disease. So like I mentioned, there are currently 10 states who are screening for Krabbe at birth. There are a few states that have these laws. They're called RUSP compliance laws. And theoretically, they would begin screening for Krabbe once it's officially added to the RUSP. But even once a disease is added to the RUSP, it can take 10 years or more for all states to include the disease on their newborn screening panel. And just an example of that is adrenoleukodystrophy, or ALD. Currently, less than 30 states screen for ALD, and it was added to the RUSP in 2016. That's 8 years ago. And that is with, if you know Elisa Seeger, that's with her tireless work and the work of so many other ALD advocates. You know, advocating for newborn screening is not easy, but thankfully, I think we're a tough group, right? And we're not going to give up until every child is screened for Krabbe and for other leukodystrophies at birth. So now is a great time to either begin or relaunch efforts in your state for Krabbe newborn screening. And I will say that the newborn screening community is finally catching on to the advancements and improvements that have been made in Krabbe newborn screening. So if your state isn't screening for Krabbe disease, you can definitely help. And we want to help you help in this effort. Every state has a different system for adding diseases to its newborn screening panel. So we will work with you to determine a detailed strategy for advocating for expanded newborn screening in your state. And, you know, depending on how long it's been since we may have talked about what's going on in your state. I mean, I would still love to talk with you because some of those strategies might have changed, and we definitely have new informational materials that we can share with you guys. But we will also support your efforts by helping identify key decision makers, like I said, providing informational resources, and then helping prepare you for meetings and testimonies. And we also connect the state decision makers with our team of medical and scientific experts who are very passionate about crybaby newborn screening, and they're willing to educate, whether it's a lawmaker or many times even like a newborn screening advisory council, whoever is making the decision in that state, they will work with us to help with that. And then finally, we do work to help gather other affected families in your state to partner with you in your advocacy efforts. So you won't be alone in any way. We'll be with you, and so will they. So I just want to say again, if you've advocated for crybaby newborn screening in your state before, because of the advancements that have been made and our progress with the RUSP nomination process, now is the time to try again. And I do want to just say, for the sake of time tonight, I did focus a lot on Krabbe newborn screening, but we are here for all leukodystrophies. So please reach out if you're interested in advocating for newborn screening for another type of leukodystrophy. I know MLD is emerging with newborn screening, and so is CTX. So, and hopefully just more and more leukodystrophies will follow, and we're committed to advocating for all of them. So please reach out to me. Here is my contact information. Please contact me if you're interested in advocating for Krabbe newborn screening or for another leukodystrophy, or if you just have questions, anything, please reach out anytime. We are going to be, now that I can't overstate the amount of work it's been to be ready to, and then to reapply for inclusion on the RUSP. So I feel like now we're transitioning into what I'm calling a new era with Krabbe newborn screening, and it's a super exciting time. So we'll be, I think, launching lots of new initiatives and efforts in the coming months, and please reach out to me if you would like to be a part of it. We're not at the mountaintop quite yet, but we're closer than we've ever been, and I just know that working together, we'll definitely get there.